Thank you very much for joining this webinar at Medcan, the Science of Behaviour Change and How to Power Through to Your Goals with Dr. Amanda Beaman, a clinical psychologist here at Medcan, and Megan McAdam, a nurse case manager and part of our all-employee offer team. So thank you so much for joining us. We have a wonderful presentation for you today. Now, before I move ahead to introducing our wonderful panelists, we're going to go through a few housekeeping items. The presentation is being recorded and will be sent to all registrants in a follow-up email in the coming days. We will also have recordings of all our past webinars on medcan.com and on our Medcan YouTube channel. Now, due to the volume of participants we have joining us, all incoming audio will be muted to ensure clarity. If you want to submit a question, feel free to do so. The screen through GoToWebinar has an option for questions. Your question will remain anonymous, and the panelists will have some time at the end of the presentation to review some of the questions, and we will try to address as many of them as possible. Finally, we will be briefly outlining the services at Medcan that support some of the strategies mentioned today, and we have a special offer for all webinar registrants to thank you for joining us. Also, the information in this webinar is for educational and information purposes only. It is neither intended to be relied upon nor to be a substitute for professional medical advice, diagnosis, or treatment. Now, before I introduce the panelists, why did we choose to cover this topic today? Well, for anyone who has set a health goal and not achieved it right away, we know that behavior change is hard, but there are very good reasons to keep on trying, and that's probably why you tuned in today. Adopting healthy behaviors can help you feel your best today, tomorrow, and protect your brain and body in later years. But what are the real obstacles and how do you get beyond them? That's what we're going to find out with our two panelists. Our first panelist is Dr. Amanda Beaman. She specializes in evidence-based treatments such as cognitive behavior and mindfulness-based therapies. She has worked in private practice as well as academic, hospital, primary care, and corporate settings. She provides diagnostic assessments, group and individual therapy, continuing education, and clinical supervision. She has been practicing as a registered clinical psychologist since 2009. She completed her doctoral training at Concordia University and her clinical residency within the Mood and Anxiety Program at the Center for Addiction and Mental Health, CAMH. Dr. Beaman is currently completing her yoga instructor training and plans to integrate yoga into her practice in accordance with its emergence evidence-based as an adjunct to psychotherapy. Dr. Beaman, may I call you Amanda?
Yes, of course.
Thank you so much for joining us today.
Thank you for having me.
And our second panelist is Megan McAdam. She is a registered nurse and a nurse case manager at Medcan, where she manages complex cases, helps connect clients with our second opinion program, including with Johns Hopkins International, and she is a health coach with the all-new employee solutions at Medcan. Megan is passionate about healthy behavior change and patient education, which led to her training with Well Coaches. Previous to Medcan, Megan was an emergency department nurse at Credit Valley Hospital, and she is a graduate of Queen's University in Kingston. Megan, so great to have you here.
Thanks so much for having me.
Thank you so much. All right, so what are we going to cover today? We are going to be discussing the science of behavior change, what works, what doesn't. Understanding the concept of self-efficacy and how it plays a role in behavior change. Psychology versus health coaching. What are the similarities? What are the differences? How to get started on your own, when to seek external support. We're going to talk about the services at Medcan, then we're going to jump into Q&A, and then final words and discussion. So as I said in the introduction, things are so complex with behavior change. So where does one start?
Well, you're absolutely right. Behavior change is complex. At this time, we know there's a little less than 100 theories of behavior change. So there's a lot of researchers out there working on this. And it seems like the more we research it, the more complex we realize it is. So we know from research that, of course, most of us value health and fitness, but actually act in ways that undermine it a lot of the time. And that if we were able to be more active, to adopt healthier eating habits, reduce smoking, reduce alcohol intake, that we could mitigate a lot of major diseases like cancer, cardiovascular disease and diabetes.
So when clients come to you, I guess they might be having these same issues. So where do you start? Where is the beginning?
Yeah, well, as going back to the complexity idea, we know that it's often a combination of factors that we're looking at that would influence health behaviors and the adoption of health behaviors. So, really, it's the challenge for researchers and organizations who are coming up with health promotion programs. The different types of factors that we know influence behavior are things like socioeconomic status, what person's skill level is at, their culture, beliefs, non-conscious beliefs, gender, attitudes, religion, and values. There's just such a wide range of health behaviors to choose from, and sometimes people can feel overwhelmed where to start. It could range anywhere from flossing our teeth to adopting a mindfulness-based kind of practice.
Right. Yeah, it seems like we've been talking a lot about going from ill to well and good to great. So when you meet someone, they might be in an ill state and you're helping them go to a good state, or they might be in a good state and they want to get to a great or higher performing state. So how do you navigate the factors? And so how do you know with the people that you're working with where to start and the different factors to focus on?
Well, that usually starts with an assessment, but there are a number of different factors that are going to impact health, and it's sometimes we want to kind of look at the research and take our cues from there. So
a multi-pronged approach.
Yeah, a multi-pronged approach. So just knowing, if you know that someone has a certain educational level, then there might be a different strategy to start with than another.
So why don't we look at an example?
Sure. So let's take alcohol consumption, for example. So we know that people of a higher socioeconomic status have maybe more access to education about health, and more access to health services in general. So they may have more knowledge about the link between drinking and health, right? But in Canada, at least, and I think in other industrialized countries as well, we know that when it comes to alcohol, despite having this greater access to education and knowing about the link between drinking and its effects on health, that higher socioeconomic status is actually linked with drinking more frequently and actually to higher risk type of alcohol use.
But what's wrong with that? I know I'm playing devil's advocate here, but yeah, so that makes sense. People tuning in, they like to have their glasses of wine or they're celebrating deals, celebrating events.
Yeah.
But I hear a but coming. Yeah.
Yeah, so we know that, excessive, but not even excessive, just frequent drinking, regular drinking has been associated with poor health outcomes. So in this case, a strategy of just providing education, like in the doctor's office, for example, you shouldn't be drinking, more than X number of drinks. I mean, I think that sector of the population knows that, but for whatever reason, they're not able to follow through with changing the behavior. And this would be where a multi-pronged approach would come into place. With the education, you want to provide maybe some skills. Direct them to a place where they could get the skills.
Like what kind of skills?
Well, we can talk about that. We're going to talk about that a little later on. And you may even want to address beliefs around alcohol, because that could be a cultural thing or some non-conscious kind of thoughts or beliefs or assumptions around alcohol use.
So with regards to the beliefs, I think we talked about the concept of self-efficacy.
Yeah, so self-efficacy is one of those important concepts that's been studied a lot by psychologists and others. And so we know that self-efficacy, higher levels of self-efficacy consistently predict adopting more positive health behaviors. So and ranging from,
I see Megan nodding her head, so this is definitely something that she talks about. So Dr. Beaman, so with regards to self-efficacy, how does that affect our perception of our ability to change or our competence to make a change?
Well, I know that this is something that Megan looks at a lot in health coaching, so maybe I'll pass it over to her.
Yeah, absolutely. So self-efficacy is really our own personal belief that we're able to succeed in a specific situation or accomplish a certain task. it can play a major role in how successful we are in taking on a challenge or a task moving forward. So let's say, for example, this gentleman that we have here who's climbing this rock wall. Maybe for the past 20 years, he's been climbing rock walls with his dad. He's very good at it. He does it every week. He has a high confidence level. This is likely that he has a high self-efficacy level. Whereas perhaps he just decided to tag along with his buddy and try rock climbing for the first time. This would be an example that perhaps he just actually has low self-efficacy.
And I would imagine you can translate that to other type of behaviors?
Absolutely. So, let's take this next example. You see in the picture a kayaker who's trying to make their way through what looks like a rough course. There's lots of different factors when they're going through this course. For example, the weather, the current state that the person is in, their energy levels, their muscle strength, maybe their state of mind that morning, maybe they had a bad day. And a big role of that is self-efficacy as well. So this is a good segue actually into, just like professional kayakers, professional rock climbers, professional athletes, they all have coaches to help them get from point A to point B and accomplish a goal. And just like that, we can actually have coaches ourselves in life, in health, in whatever aspect that we might need. Health coaching is really about applying some one-on-one support and accountability so that we can help to change people's behaviors to live healthier lives or perhaps manage certain health conditions. While we may not all be professional athletes, I know I am certainly not one, our health challenges are certainly not less important or insignificant. So similar to professional athletes being coached, health coaching is really about partnership. So working with your client and really helping them to provide encouragement, provide a sense of accountability, and generally just achieve their goals. So that includes finding out what their motivation, strengths are, and helping them utilize that moving forward.
That makes total sense now that we're looking at kayakers and rock climbers. We're not all those things, but we do have, so many options, so many factors when it comes to food, when it comes to exercise and work aspects. So Megan, can you explore some of those achievable goals and knowing what we want to do but not getting there?
Yeah, absolutely. So I put up some examples here of some small goals that you might want to try building. And again, the most important thing that I know Amanda is going to touch on in a little bit is making small, specific, and achievable goals that then we can build upon and keep getting better. So for example, healthy eating. Let's say over the next week, you want to make sure at least one of your meals has half a plate of greens. Another one might be that you're dealing with cholesterol, high cholesterol levels. A goal could be, how do we manage your diet and physical activity level? Or perhaps even, how do I remember to take my medication every day? I always forget, and it comes through in my blood work that I get done in 6 months. So anything like that really is what we'd focus on.
And those seem pretty relatable, but what, if someone wants to actually eat better every day, those changes seem to be quite big. It's hard for someone to start eating greens if they've been eating red meat and potatoes every day. How would you support someone in that type of situation?
Yeah, you're right. I mean, asking someone to jump from A to B without figuring out where they are is impossible. So as health coaches and really any allied health professional, I'm sure Amanda can agree, it's about meeting them where they are. So not forcing them to come where you are, where that healthy behavior is, but jumping back and being with them. And that really has to do a lot with the behavior change stage process or stages of change. This process is so unique and so individualized person to person. Where I might be may not be anywhere that you might be. So we can delve a little deeper into that.
Great. The science of behavior change. This is what we're here for.
Absolutely. So this is one of my favorite examples and diagrams because it really just clearly shows out what the stages are and how you might be feeling in each stage. So the first stage that we're looking at is the pre-contemplation stage. In that stage, I might be thinking, not for me, definitely not me, I'm not ready, not there yet, not even thinking about it. The next one would be contemplation, and that one you might be thinking, well, maybe I'll take a look and maybe I'll start to think about it, I'm not sure yet. The third one is preparation. Okay, I think I want to do it, so what do I do now? Fourth one would be action. All right, I'm ready, let's do this, let's get it started. And the fifth and final one is maintenance. So you've completed that goal and you've completed that change, and you're thinking, it's possible. I can do it. My self-efficacy in this is really high now.
So Amanda, you're nodding your head. Is this something from a psychologist perspective that you also see, or this is how you look at things with your clients and the people you work with?
Yes, we do. And I think, there may be some differences between the two of us and how we approach it, depending on the client. So certainly it's great if someone comes to your office and they're in the preparation stage, you're like, yeah, let's get going. But sometimes with me, that's not the case. So people are coming to me, let's say, and they don't know. They know maybe something has to change. So let's take anxiety, for example. They know that anxiety is disruptive to their life, but they're kind of scared to make the change, but they kind of know they have to. So we might start at number one. We might be there at pre-contemplation, because sometimes changing anxiety means confronting fears. It's not that they're unmotivated to change the anxiety. It's more that they may not be as motivated to confront the fears, to do what has to be done in order to address the anxiety. And so I may be starting at one. And I don't know, Megan, if you are starting there or if you're starting somewhere else around the...
Yeah, so again, you kind of meet people at all different stages. Something that might differ between us is that if I have or let's say for me, for example, if I'm wanting to change healthy eating and physical activity, and I realize that, for healthy eating, I'm really just in that contemplation stage. I'm not ready yet to kind of make that change. But when it comes to physical activity, I'm really in the preparation action stage. I'm ready to get started. Starting with goals in the preparation and action stage are more likely to be successful for me. So starting in that area, becoming successful, seeing how well I could do it is really a benefit. But also taking that time to honor and saying, hey, you know what, for healthy eating, I'm just not there yet, but maybe I'll start thinking about it. Maybe I can see how well I'm doing in my physical activity and then move on to healthy eating.
So Megan and Amanda, you both seem so accepting and so patient with people. What happens when there's actually some major changes that need to be done? Like someone just had a heart attack and they need to actually change the way they're behaving. What is there a different approach when there's urgency?
Well, I think we're still nice and accepting. I don't think that part changes.
Not at all.
I mean, often when someone has had a major event like that, their motivation
skyrockets.
Yes. So we might be seeing, and if it hasn't, then we'll talk about the other skills, the other strategies, but this might be where kind of galvanizing social support and other people in their lives becomes really important.
So with regards to motivation and then your example of anxiety, it seems like the conscious and unconscious, knowing what you need to do or not knowing where to go. So could you explore a little bit more of the beliefs and that aspect that, if you could go with that.
Yeah, so sometimes people are coming and they know that, so for example, I have a lot of anxiety at work and I feel like I'm avoiding a lot of things, but I don't know why. I just kind of get to the meeting room and I feel really anxious, so I make an excuse and I avoid it. So this would be where we're exploring non-conscious kind of factors. Well, when you started to feel anxious, what do you think you were thinking about? Like what were you predicting was going to happen in the meeting room? So we'd want to look at, are there any assumptions there? Or are there some negative expectations about what's going to happen, and give some tools or skills to help challenge those ideas.
And that's your CBT approach?
That's the CBT part, yeah.
Okay.
That's the C in CBT.
Thanks. Well, I think we're going to explore this a little bit further with some case studies that we're going to. So I think we're now focusing on the approaches and the strategies. So Amanda, I think you were going to tell us a little bit more about what we see here.
Yes. Okay. So this is really getting down to brass tacks here with the actual skills that we, I think any CBT therapist would use this in every single session, right? So, and probably Megan, you identify with a lot of this as well. So, the very first step, of course, in the assessment phase, we're deciding, okay, what is the problem? Like what behaviors do we need to target? So let's use the example of workplace anxiety, because I think people can relate to that. So I have anxiety in the workplace and I find I avoid a lot, and it's not helping me in terms of my career progression if I'm avoiding things. Okay, so we've decided on our target behavior. Now, we might get the person to start self-monitoring their anxiety throughout the day, just for me to collect data, for me to see, okay, what are the triggers, specific triggers, and also for the person to collect that data for themselves. They might start to build more awareness around why they're avoiding. And then, once we've decided on what we're going to tackle, there may be some education that needs to take place. So we need to maybe talk about what is anxiety, how does it manifest, how does it work in the body, and those types of things. And then once we've kind of gone through some education and we've talked a lot about how this is going to play out, then we want to start setting some specific goals. And that's really kind of some of the examples that Megan gave, like very, very specific. So it's not going to be, the goal isn't going to be vague, like, okay, I'm going to work on my anxiety tomorrow. That really wouldn't help, right? So we want to really break it down to small steps. Like, okay, tomorrow we're going to try to initiate a conversation with a coworker who you feel comfortable with. And then we build from there. Before the person leaves the office, we want to anticipate or plan for any obstacles that might come up in the course of the week and them executing this step. And of course, we're always measuring progress as we go, because this is a positive feedback loop where we measure the progress. People can feel kind of motivated for what they've achieved, and it helps to propel things forward. And then on the sides I have here, elicit social supports and an adapting environment. So sometimes in order to help people achieve their goals, we need to look at the environment. Is it conducive to that? If it's an exercise goal, we need to make sure there's the equipment and you can get to your appointments and so on. And also maybe we need to get the social supports on board, and that can take many forms. So it could be maybe you have a buddy at work who you tell that you're going to be working on your anxiety with, for example, or in the case of exercise, online. There's a lot of online kind of programs where there's support online, and people find that to be really helpful in keeping them motivated for their goals.
Well, that makes a lot of sense in theory, and I think that our audience can understand what you're talking about. Let's explore a few case studies and see that in action.
Sure.
So Megan, I think you're going to start us through with one case study, and what topic are you talking about?
Yeah, so the first case study we're going to look at is getting negative stress in check. And the second one we'll look at will just be about increasing physical activity. So stress. I'm sure that word can resonate with a lot of us. We've all either been there or know someone who's there right now. Pressures just never seem to cease, and that can be hard for us. So Amanda touched on some skills or strategies previously to help get you through these behavior change. And I just wanted to delve into this case study of a woman, we'll call her Jane, who's really stressed at work. She can't fall asleep at night because of her stress. Her mind is just constantly racing. And she keeps thinking about everything that she needs to do, which has led her just to further stress at work. Her work's actually struggling and continues to pile up. In speaking with Jane, we discovered that what's really important to her right now is finding a way to deal with her stress. We discussed the way she deals with stress in the moment, which is probably how most of us deal with it. We just don't. We hide it away, we push it aside. She asked for some specific recommendations on things that she could try the next time she was feeling stressed. And instead of just kind of giving her a bunch of different techniques, we actually brainstormed together some ideas. So focused breathing, maybe taking 10 minutes, going for a walk during lunch. And we had a great conversation about ways that she found in the past to be helpful when she was feeling stressed. So she did mention a time in her life when she would make sure to take 20 minutes a day for mindful meditation. And she took that time for herself just to reduce her stress levels. So when we were chatting about a goal to set for the upcoming week, she actually decided to create her goal based on the technique that she found successful in the past, which was meditation. And her goal was, on Monday and Wednesday, I will set an alarm on my phone to remind myself to take 20 minutes of time for meditation. So it's very specific. We anticipated that, hey, she might forget. Right? It's life, it happens. So we added in the phone reminder so that it would help her remember. And then one other avenue that we explored was for her to log into her digital health platform and take a look at a journey called 10 Minutes a Day to Stress Less. That way she'll stay engaged on this topic throughout the week, and she can take part in a different journey as well if she'd like. Amanda, I don't know if you want to delve in a little bit from your end and your perspective on this.
Yeah, well, I mean, it sounds very similar to the type of thing that I might work with a client on. I mean, it's always great when people come with already having like self-efficacy kind of in some strategy that they've used in the past, and you can build on their strengths and build on their past experience. I guess sometimes people might come with really not knowing where to start, and then that's the place where it may take a bit longer for us to build a bit of a skill base. So,
or they feel overwhelmed and there's so many factors, they don't know which one to address first.
Yeah, and so much out there on stress management. So which one is meditation? Is that the place where I start, or should I start with something else?
And we do talk about meditation and mindfulness at Medcan, and it's in the public sphere. But is it, Amanda? You do this with your clients. Is it for everyone? And I personally know that it took me 5-10 years to adopt a mindfulness practice. It's very difficult.
Yeah, it is difficult, and I think it's important for people to realize that ahead of time. I don't think we should be kind of flippant about suggesting mindfulness or meditation to people, because especially when someone's experiencing quite a bit of anxiety, or they're in a very stressful period in their lives, asking someone to sit and pay attention to their thoughts, or to pay attention to their breath, but really what ends up happening is that they're paying more attention to their thoughts, could escalate anxiety. And so we just want to make sure that we're timing the skills right. So I might be inclined to start more with some cognitive strategies first and some education. And then as we're seeing stress starting to maybe reduce a little bit, or anxiety starting to reduce a little bit, then we move more into meditation. Having said that, if someone came to me and said, I've practiced meditation in the past and it really works for me, then I'd jump all over that as well.
Right, so personalized attention, customized care from both of the psychological and health coaching approach. It really matters of meeting people where they are and going with their strengths and going with their current state. Okay, Megan, let's go to this fitness case study that you mentioned.
Yeah, absolutely. So up next, we'll talk about increasing your physical activity or moving more. Maybe that means more strength training. Maybe that means just going for a walk every day. Or maybe it's finishing that half marathon that's been just sitting on that bucket list for 5-10 years. So in this one, let's take a look at a father. We'll call him John. A father with a young child. So his activity level since his child was born has certainly decreased. He's been finding recently that as he's trying to keep up with his son, he just can't. He's out of breath. He has to take breaks. And he feels like he's really missing out on that quality time to be enjoyed with his child. We discussed some barriers in his life that has really been preventing him from getting fit and getting active and perhaps ending up where he is right now. And he said, probably, which is the most relatable for everyone, is that he just doesn't have time. He gets home from work late, and that precious time that he has, he wants to spend it with his child and spend it with his wife as well, and just spend that quality family time. So through brainstorming and discussion, he came up with the following goal. On Wednesday and Saturday, my family and I will go for a 20-minute walk together outside. So he created that specific goal. He took into account possible barriers and really involved his whole family in the process. So he's not losing anything by doing this. When I checked in with him the following week, he said they enjoyed their time together outside and just enjoyed being able to move around, get active as a family. Again, it's a small, specific, and achievable goal that we'll just keep building on.
So this guy, John, he sounds really gung-ho. He is ready to make changes. He's in that stage, in the stages of change. He is ready to make change. What happens if someone has children, has a family, and they have reduced their energy, but their mood is also low? Perhaps they have a bit of more aggression. Maybe there's something else going on. Amanda, what's the psychological approach to that?
Yeah, so we would certainly, with something like depression, we do want to look at getting people activated in terms of the behavior, because often what tends to happen with low mood is people tend to withdraw and reduce their activity engagement. But before we jump into that, I think we maybe want to just understand exactly what is going on. Is this depression? And if it is, then we want to make sure that we're also using other tools maybe to cognitive tools would be the other side of it in CBT. So yeah, it's just maybe doing more of an assessment to get at what's happening with the mood.
When someone comes in to you, Amanda, and says, I'm having low energy, how do you actually rule out the other aspects, the medical aspects? If there's a thyroid issue or what? I'm going a little off here, but if someone's having low energy, they're working with a health coach, and then.
Yeah, I mean, somewhere like Medcan, that's great because, we have access to the chart and access to their physician and getting permission to talk about those things. And chances are that's been picked up by their physician. But I might say to them, let's rule out everything. So next time, let's make an appointment with your physician and just make sure that those things are ruled out before we jump into the behavioral stuff.
Amazing. Okay, well, I think it's now a good time to just talk about when is it a good time to consider seeing a psychologist if they want to go from ill to well or good to great. So Amanda, the psychologist on the panel, let us know, when does one consider seeing a psychologist?
So I had put here that when behaviors feel very automatic. So this is where, kind of back to the anxiety example, it's like, I know I just feel anxious going to meetings. I'm just not really sure why. And then I avoid before I realize I'm avoiding. And then afterwards I'm, kind of dumbfounded as to why I'm doing that. So that might be a case where seeing a psychologist is appropriate because we'll be exploring kind of what are those non-conscious kind of thought patterns that might be leading to that. The other thing would be, you've had a lot of coaching and, it just you keep reverting back to old patterns. And so that would say to me, like, well, maybe there's something else going on. Like maybe, for example, there is depression in the background, where as your mood improves, you're able to take on these challenges and tasks and function really well. But then when something happens and your mood starts to worsen, then you're back to old patterns of withdrawal and inactivity. And so that would be another example, which speaks to the next point, which is there's signs of a mental health issue present. So again, like kind of really debilitating anxiety.
What does that mean, debilitating? Is it interrupting your daily life?
Yeah, so it's interrupting your functioning. You're not able to concentrate. It's kind of, again, causing a lot of avoidance. So maybe you really want to get in shape, but you can't go to the gym because you're feeling too anxious about being around people, for example. That would be a time when seeing a psychologist might help. And then, of course, when we see that behaviors are kind of in the more extreme end of self-harm or really destructive or present a risk to the person or others, then that would be a time to seek the help of a psychologist.
And I think our culture is changing, that once seeing a psychologist or a psychiatrist or a doctor and talking about mental health issues meant you had a problem. Mm-hmm. But what we've explored today is that not necessarily when you have a problem, it might be that you feel like you're hitting like a wall, mm-hmm. and you want to explore where you can grow. So do people come to you for those type of matters?
Yes.
Like performance, growth?
Yeah, self-esteem, self-confidence, those types of things. Yeah.
All right, so thank you so much. And let's find out why would you consider going to a health coach?
Absolutely. So a health coach is really, a lot of the time we know the changes that we have to make. Maybe we leave our doctor's appointment, maybe we leave at lunch with friends and everyone's chatting about it. You're getting information from everywhere, every angle. So we know we're ready to make the change, but it's so overwhelming and we just don't know what the next step might be. So having a health coach to work with you sort through that would be very beneficial. Maybe you're feeling good, but you want to get to great. Or maybe you have chronic conditions that you want some support managing. So diabetes, hypertension, osteoarthritis, anything like that you really just need help and support while you work through those chronic conditions. And then finally, one of my favorite quotes or mentions is that you really want to thrive, not just survive, because it's so easy to just kind of take it day by day. We're getting through, we made it to the next day, but really thriving in those days and being the best self that you can be. Those would all be options, and the health coach would really just help you determine, what are your strengths, what are your motivations, and let's get you to great or better if we can.
So does it help to know your health history? As a health coach, would you know that about the person you're working with?
Yeah, absolutely. So one thing that we like our clients to do is to fill out a Compass Health Assessment. And that just gives us a background on things that they've been working on, maybe things that are bothering them, and things that they know they want to work on. So we have that information armed and ready to go before even speaking to them.
And then what about learning about our families? Like if we know that there's osteoporosis in the family, or that a family member had a stroke or had colon cancer, how can you as a health coach help them perhaps take preventive measures in their eating or moving choices?
Yeah, absolutely. So that would just be, again, working on goals that would be preventative in nature. And it's not about me telling them, you have to do this, A, B, C, D, that's it, period. It's really about working with them. What goals work best for you, and where do you want to start?
Okay, great. Well, we do have a few questions. So while the panelists are reviewing the questions, I'm going to take a few moments now to speak to some of the services at Medcan that were addressed today in the webinar. So first, we're going to speak to Mind Health, and this is the team that Dr. Beaman is on. So as Dr. Beaman addressed, so if someone you or someone you care about is struggling with conditions such as stress, self-esteem, personal performance at work, depression, anxiety, Medcan can help. Our Mind Health team is comprised of psychologists and psychotherapists with expertise and experience in individual and relationship and family counseling. Our team can help you take control of your mind health through high quality, personalized, customized care. And we understand that integrating technology into a team-based approach is important to achieve your overall health and well-being. You can call us at 416-350-5949 or email Paul Takeda, PaulTakeda @medcan.com. And we have services in person and virtually by video in Ontario. And then Megan is part of the health coaching team. Our health coaches are certified behavior change experts who offer one-on-one support and accountability to help you live a healthier, happier life. Coaches leverage interactive journeys through a digital health platform to guide and support behavior change. They can help you achieve many goals that were addressed today, such as weight loss, stress and resiliency, and managing chronic conditions. And for all of those who registered for the webinar today, we do have a complimentary 45-minute session with a Medcan health coach, someone like Megan. And this is an offer that expires July 6th. So if you are interested, please contact us at the email is healthcoach@medcan.com, or the number on your screen, 416-623-1041. Okay, we're going to go to some questions now. We only have a few minutes. We are mindful of time. So Megan, I'm going to ask you this first question. Actually, it's my own question. And when people meet you and you say you're a health coach, I would imagine they might say, oh, can you give me some tips? How do you address those people who you see at parties or on the weekends?
Yeah, absolutely. I think that's one of the most common questions is, hey, I have stress. What would you tell me to do? And my first statement would be, I wouldn't tell you to do anything. I would want to really find out, have a conversation and make it as personalized for them as possible. So working with them as opposed to telling them, which is the whole point of health coaching.
Okay, so it really is a distinct way. It's
Absolutely.
more partnership oriented, as you said.
Yeah.
Okay, the next question, Dr. Beaman, Amanda, why don't people succeed at New Year's resolutions?
Often it's because people have set the goal too high and it's vague, right? So it's like, I'm going to get in shape in the new year, and and I'm going to go to the gym every day. And if you've gone from not going to the gym at all to trying to go to the gym every day, that might last for a couple weeks, and then it's just not sustainable, right? So the point, I think we've alluded to a number of times, is just making the goals very specific. We want to be strategic in how we plan them, and kind of breaking them down and planning for obstacles as well.
Okay. The next question is about nudging. Megan, I'm going to address this to you. The concept of nudging, it's been in the media. There's a book called Nudge, and it sounds like you're a bit of a nudger. How often are you connecting with the clients that you meet? And are you sending them nudges? Are they getting nudges from their families or friends or their accountability buddies?
Absolutely. I mean, nudging is a bad thing to call someone, I think, but we'll go with that. So I try and keep in touch at least a couple of times a week through email in particular, just to make sure that they know, hey, someone's looking out for me, someone's holding me accountable, and also, just to be that support for them. So if they have a question or maybe something didn't go great in their goal, then we can course correct as needed.
Okay, thank you. Next question for Dr. Beaman regarding expectations. If someone comes to see you, what are the expectations that you'd like to manage? If they're having anxiety, as we talked about today, will that anxiety be resolved with one session?
No, not typically. Yeah, so yeah, we would want to talk, and always in the first session we do talk about that this is a process, and anxiety is learned in many ways, and so the good news is we can unlearn it, but that takes time, just like it took time to learn it, to make associations between certain things and to become anxious about certain things. That was a process that happened over time in practice. And so unlearning is going to take time and practice.
So when you're unlearning, are you actually learning new adaptive behaviors?
Yes.
And can you speak at all about the neural pathways in our brains that, kind of adjust with regards to mindfulness?
Yeah. So, I mean, certainly what we practice grows stronger, right? I think I'll just use that catchphrase because, and so if we're practicing patience, compassion, positive thinking or balanced thinking, I would say, then that's going to grow stronger. If we're practicing impatience, lack of empathy, kind of a negative thinking pattern, then that's going to be what grows stronger. And so this is where we
I've never heard the term balanced thinking. You corrected yourself.
Yes.
You said positive thinking and then you said balanced thinking. Can you talk about that?
Good catch. So a lot of times people confuse CBT for positive thinking, right? And that's not really what we're talking about. We're talking about balanced thinking. So this is holding the good and the bad, right? So in life, there's problems. In life, there's stresses. Things don't go our way sometimes, but so we're not saying that everything's puppy dogs and rainbows, right? That's not our way to help improve our mood or lessen our anxiety. We want to look at, okay, well, these are the problems, but am I magnifying them in some way in the way I'm thinking or the way I'm behaving? Am I reinforcing that or am I making it worse? And so that's where the balance comes in.
That's amazing. Okay, well, we have 1 more minute, so how about we just wrap up? I'll give you each the chance to say if you have any words of guidance for anyone tuning in who wants to make a change, whether that's changing the way they eat, changing their anxiety, what would you say to them right now? Megan.
Yeah, I think I would say change is hard. We're not sitting up here preaching that it's easy overnight change, as Amanda said, and it's okay to fail or to backtrack if it's what happens, it's what happens. But it's all about moving forward and being armed with the best tools possible to keep moving forward.
Yeah, I think I'd probably reiterate that because I think there's a sense maybe sometimes that, I should be able to do this. I should. Well, if it was so easy, none of us would drink too much. Everybody would exercise. Everyone would eat properly. And we don't. And so that alone tells us that this is a complicated thing that we're trying to do. And so, getting help or just making sure you're breaking things down into manageable steps, I think is probably really important.
That's great. Well, thank you so much. We'll leave it at that. Dr. Beaman, thank you very much. Megan, thank you very much.
Thank you.
Thank you to everyone who joined us and giving us your lunch hour. You will be receiving a survey following this once I stop the recording, and then a recording and a recap of this webinar will be sent to you within a couple days. If you are interested in that offer, please let us know, and looking forward to seeing you at our next webinar. Hope you have all a wonderful afternoon. Thank you.